The pandemic is behind us, but the state is still sitting on piles of medical equipment bought at the onset of COVID-19. It's in storage facilities across New York. The state comptroller just released an audit on the situation, and he joins us now. Tom DiNapoli, thanks for being here. Really appreciate it, Tom.
Great to be with you.
So let's start here. How much medical equipment are we talking about that the state's in possession of right now?
Well, you know, as you point out, at the onset of the pandemic, there was a real rush for the purchase of what we call durable medical equipment, things like CPAP machines, oxygen tanks, ventilators, and so on. But close to $250,000, 250,000 items, $450 million worth of equipment was purchased. And what we found in this audit is that of that close to 250,000 items, only about 3 of them were actually ever utilized. Wow. So the balance has really been sitting there in a stockpile in warehouses across the state, could be put to better use. And the real lesson, I think, to take from all of this, it's easy to look backward, right? But how do we look forward, better manage the stockpile for, God forbid, the next public health emergency that may come down the pike? I'm
guessing not only did we pay to buy it, but we're now paying to store it too. Do we have any idea how much we're paying to store it, or is that not necessarily a fair?
No, it's a fair point. Now they have consolidated some of the warehouses, so between Department of Health and Homeland Security, they've been realizing some savings by consolidating where they're placing it. I don't have a dollar figure in terms of the amount, but suffice it to say there are rental costs that are being spent. I think what is also significant is that they had a committee that looked at what would be an appropriate level to maintain as far as the stockpile to be prepared, and that committee identified a little over 50,000 items. So the question is, what are we doing with the items that don't need to be stockpiled now? There was some effort to reach out to hospitals and healthcare facilities across the state. There was an initial response saying we could use some of this equipment now, but there has not been the follow-through to distribute that equipment. There's also a concern because some of the equipment requires maintenance to keep it in a state of good repair, to make sure that warranties, in fact, can be honored. And that preventive maintenance hasn't been happening on many of the items as well.
Yeah, I was going to ask you if any of it is still good or not, or if
well, that's the question, because
we don't really even know.
I mean, that is absolutely the right question, because what we don't want to find ourselves is in another emergency situation. You pull out a ventilator or some other kind of medical equipment and find it's not working, or it's not working up to speed, and you go back to the manufacturer. They say, well, but you didn't do the required maintenance. The warranties run out because of that, and that leaves us holding the bag. I think another important point about the audit is that the normal procurement procedures that would involve the agency, in this case Department of Health, the Office of General Services, OGS, which does much of the procurement for the state, those were suspended in the face of the public health emergency. And we all understand it was an emergency time. That being said, when you totally suspend the normal ways to purchase this kind of equipment, it's no surprise that perhaps in the effort to have shortcuts, we didn't get the best value in terms of what was purchased. There's not a clear accounting for what was spent. Did we get, in fact, the equipment that we actually paid for? And certainly in this case, we have such an oversupply now that we have to warehouse. Obviously, not the best measurement about what we really needed. So I think what it really suggests is, even in an emergency situation, do not throw out all the normal procurement procedures that really benefit the state in terms of getting the best value and frankly, in being more efficient. When it's an emergency, OGS knows how to expedite, purchases when you have to. And I think that's really, to me, the key lesson for moving forward. We can't undo what happened. COVID was a crisis time. We understand that. A lot of mistakes were made then as we respond to the emergency, but let's not repeat those mistakes should we face another public health emergency down the road.
Yeah, I only got about 30 seconds left, but basically, are you comfortable that we're getting to a place where we're going to have a plan to figure out what we do with all this stuff, and then kind of sounds like we at least have some idea of what we should do to prevent this in the future?
You know, I think our recommendations are clear in terms of doing better management of the inventory and maintenance. The Department of Health acknowledged what we said. I wish they had been more proactive in embracing our recommendations. So this may be an area that we'll have to follow up on again down the road.
All right, we'll keep an eye on it. Tom, thanks so much for your time today. Really appreciate it.
Thank you.